Hello, my name is Adam. This is my bsn246 NG tube insertion video. For this, I'll need a few things, which will be my patient who's going to need an NG tube placed with an order from a provider. I'm going to need something for hand hygiene, a vessel for the patient to drink out of, with ideally a straw to help with that. And then I have a basin, which in this case is just a bowl of water that will help with the softening of the plastic of the tube. Something for the patient to have on their stomach or on their abdomen or torso to help with emesis, potential emesis. Some gloves, a pen light, a paper clip for securing it to the gown, some lubricating jelly, and then my tube. So what I'll do is I'll make sure I have the right order from the provider that I indeed do need to insert this NG tube, either for tube feeding or possibly prior to surgery if they might have, a possible bowel obstruction or something of that nature. So I'm going to go into the patient's room, knock on the door, close the curtain, allowing them privacy, ask for their name, date of birth, which they provided me, and then explain the whole procedure and who I am to them. In this case, I'm Adam, and I'm going to be your nurse, and there is an order that the doctor has to place a tube into your nose that's going to go into your stomachs. That's going to allow either some feeding tube or suctioning some of the contents out to alleviate some pain from a potential bowel obstruction. Do you have any questions for me? They say no. So we'll go ahead and get things started. So I'm going to get my hands washed here. And then I'm going to get my patient in the semi-Fowler's position, which is going to be kind of, a high seating angle. And then I'm going to inspect the patient's nose, nostrils. They can do what's considered a nasal flare. They put their finger on the opposite side and then blow, and I can kind of see and gauge which nostril might be more appropriate for me to go down, either which one's going to be bigger. And then I'm also going to use this pen light and have them extend their head back and look and see if I might see any either irritation, lacerations, things like that, something that might make it more difficult for me to insert the NG tube. So I'm going to help them bring their head back, and I'm just going to look with my pen light through either nostril here, which both are looking pretty solid, so I have a good options. I can have them blow into either one. And so I'm going to go with my patient's right nostril, or the right nair. So we're going to go ahead and get things all started here. Got my basin, or not my basin, my towel. Get all of this stuff out. And then I also have, I forgot to say in my supplies kit, my syringe that I'm going to be using to aspirate stomach contents, and I'm also going to be using that injecting air to assess placement. Another thing I forgot too, which, sorry, I'm doing this after the fact, was my pH test that I'm going to be making sure that I'm actually getting appropriate gastric secretions, kind of helping with the placement as well, or verifying placement. So I'm going to get my tube out, and I'm going to measure the length from the tip of the nose to the ear, and then from the ear to the xiphoid process, which is kind of like the middle of your sternum here. So we're going to go from the nose, and I'm just going to make sure that you guys can see it. And I'm pretty sure this is supposed to be their ear, so I'm going to go from there. Okay. And then from the tip of the nose, which we're just going to call that their xiphoid process, and I'm gonna say that's 42. Just their pretend xiphoid process, which is essentially the table, but that's how it is. So we're going to remember 42 is our marker, and then with our tape, I will mark that so I know that when I hit that spot, or that number, that I'm in the correct placement, because that'll be kind of where the stomach should lie. And I'm going to get some tape ready here, because I am going to, like I said, once I have the plastic a little bit more, so to speak, malleable with the warm water, I'm going to then just use one of these to help me with kind of like my guide placement, and then the other two I'll have when I use for securing. In a lot of settings, like where I work at the hospital, we have actual things that they use for locking the tube in place for people that have these for long periods of time. It's just kind of a stat lock sort of mechanism, but in this case we're just going to use some tape. So we're remembering 42 is our number, and I'm going to kind of wrap this guy up and put it in my warm basin here with the warm water, and just kind of make sure that that's looking good, and that it just makes it more comfortable for the patient. It also makes it a little bit easier for us as the nurse to maneuver the tube while we're going into the patient's nose. And then I'm just opening up my jelly tube because I'm going to put that in right before I go in, and 42 is our marker. So 40, 1 and 2, and then so 42 is right there. I don't know if you can see that, but 42. Hopefully you can see that. And I'm going to put my tape on the back side of it, so I'll be right at that marker, a little black line. So right there. And we're going to get our patient ready to go, because having seen this done in real settings, it is not a very fun thing for the patient. So we're going to make sure that mentally they're prepared as well for this. And we're going to coach them through the entire thing. It's also good to have alongside with our towel an actual empty bucket for some potential emesis for the gagging that they might have. And then we're also going to give them this cup with water. That way, when we get to their oropharynx, that will have them start swallowing, which will assist us with the progression of the advancement of the tube going down their esophagus into the stomach. So are you ready for this, sir? We're going to go ahead and go really slow. If you're feeling any uncomfortability, please let me know. And then when we get to a certain point, I will have you start taking some swallows of this water. And they said they're ready to go. So we're going to go ahead and advance, okay? And we're going to just continue to breathe deeply here. Doing all right? They're feeling okay. They're tolerating this well, so we're going to keep advancing. Like I said, we might start feeling some gagging here. We're going to follow kind of the natural curvature of their nose here. Okay. And we're just going to pretend that they started gagging, so we'll have them drink some water, have a swallow, and then we can just have them kind of swallow normally as well. So keep on swallowing. You're doing really good. Keep going, keep going, keep going, keep going. And we only want to advance a couple inches at a time, so we really want to make sure that we're doing, the patient justice, because this is not a very fun procedure for them. You're doing really good. We're almost there. You're okay? Okay. And a couple more. And we are at our 42. Are you doing okay? And they're going to say they're doing average at best with the tube down their nose, as good as you could expect. So now what we're going to do is we're going to first aspirate and make sure that we're getting some gastric secretions with our pH test. That's going to determine if we're in the stomach, because the gastric secretions, the pH of hydrochloric acid is extremely low, so we want to see something that's either at 3 or potentially a little bit even lower sometimes. And I'm going to do this, take off that guy, and then actually I'm going to just put this in our anti-reflux valve here. And we're going to aspirate a couple milliliters of the stomach content here. And we're going to perform our pH test. And okay, we got a score of less than 3, which we're going to assume is very acidic, which is going to help indicate knowing that we're in the stomach, because that's indicative of hydrochloric acid, like I was saying. We're also now going to make sure that we have correct placement with auscultation. I'm going to aspirate 5 to 20 milliliters of air, and I'm going to make sure I can hear a whooshing sound, and if I can't, I would have to restart this entire procedure over. So we're going to go ahead and take ourselves a listen. And we'll put the stethoscope to their stomach, and I'll get my 20 mLs of air and aspirate. And I could hear a whooshing sound, so we're gonna determine that our placement of the NG tube is correct, making sure that the patient is still comfortable with how they are. In this case, they're as comfortable as they can be. And now we're gonna kind of give this a little bit more of secureness to their nose with this incredibly sticky tape. And I don't wanna make it so they can't breathe either, so you got to be kind of mindful of that. And like I said, if they have this in for a long period of time, we would use kind of like it's kind of like a stat lock, and it would lock into place. It makes it a lot more comfortable than just taping it to someone, because with one of these, any little bit of movement can be extremely uncomfortable, which is why we would also use a safety pin, and we're going to secure that to the patient's gown. That way it just has a little bit more minimal of movement, and we're just going to pretend that the gown is now this towel that they had. We would then put them in a either put this to suction or tube feeding, depending on what the need for the tube would be, and we would also make sure that our patient is feeling comfortable with how the tube is, and if they have any questions going further. In this case, they are feeling comfortable how they're placed, and they don't have any more questions, so I will go ahead and take off my gloves, get everything all cleaned up here, dispose of things that I need to. I would do some hand hygiene, and then I'll make sure that I document the placement, the time of placement, and how well it was tolerated, and how the procedure went. And that would be the entire thing. So thank you very much.